More pronounced cheekbones or a better defined chin? You can have them both. Dr. Michael Eisemann says cheek lifts and chin implants are less painful than a whole facelift, and they're cheaper too and can basically do the job. So are there times when people come in thinking they need a full facelift when really all they need is probably just the cheeks and hands to...
What we're trying to do is to volumetrically expand the facial skeleton. A lot of times the facelift is for loose, lax skin, but what is bold and strong and dramatic is attractive. And there are several promontories of the face, the nose, the chin, and the cheek, and we're trying to augment those. And it's usually used as an adjunctive procedure along with the facelift procedure or alone.
Okay.
It depends on the patient.
Let's take a look at some folks who've opted to do some things out, in this case, the cheeks, and it may not be so obvious there until you see the afters, but on that you can see kind of the sagging, almost kind of the aging of the face.
It is. This individual had a flat midface. And basically, there are several surgical procedures to take care of this condition, what we call craniofacial surgery or orthognathic surgery.
Okay.
In this case, this is a simple method where an implant can be put in safely, simply, predictably.
Is that what you have in your hand there? Is a cheek implant?
This is, well, here we have some, there's a cheek and a chin implant. These are various sizes, and I use these as templates and put these on the facial skeleton so the patient can see exactly the outline of the implant, where it would be situated in relationship to the skull. This is a very large implant that's placed over the zygoma or the cheekbone, and it highlights the face, it highlights shadow and light, and it gives a very dramatic look to patients.
We're looking here at, you can see that she has the cheekbones in now, and it just gives that whole kind of, it's a more youthful look to have the cheekbones lifted.
It is. It's more youthful. It's more dramatic. It highlights the face. It changed the face from a rectangular configuration to more to an angular configuration.
Okay. Downtime in something like this?
This is very, very quick. Within a week, the swelling is pretty much down. Often you're combining it with another procedure, either a rhinoplasty or nasal surgery or a chin procedure.
Dramatic difference here of this person got their chin and their nose altered, and it got a chin implant because before they had the case where they almost just didn't have one.
Right.
Was there something else like liposuction done on the neck also?
This man had a liposuction of his neck. He had a facelift performed. He did not have a chin implant. He actually had a mandibular osteotomy where actually brought it forward. And in those cases where we're bringing the chin more than a couple of centimeters forward, it's very hard to do with an implant because the implant will be palpable and it'll be visible. Here, if we can do a procedure without putting any implant at all, that's the preferable choice, whether it's a breast implant or whether it's a cheek or chin or buttock or calf implant. This was a doctor's daughter, and he came in with his daughter, and he was talking about her nose. Well, if you disregard the chin, her face is not in balance. You can see when she closes her lips, she has what we call a mentalis muscle strain. That's the muscle under the chin. And she's actually forcing her lips together to do that. And after the surgery, you can see her lips together. Well, you don't show it here very well, but you can get her lips together very easily without straining. Her nose and face are in balance.
And she looks like a different person.
It is.
Just from the side.
It is. This is about 1 month later.
Okay. And we have one more picture we want you to explain to us.
Well, this is an individual who came in again for his nose, and he had some irregularity of his nose, but he wanted a very dramatic look. We did his video imaging. We actually digitally morphed his preoperative picture and showed him what he would look like. This is a very dramatic, very, very strong chin. This is his aesthetic, what he perceives himself as attractive, and he's a very good-looking guy, and we made him look better. And we did it by chin and nasal surgery and cheek implant. What
does somebody look for in a doctor who performs this? Do you have somebody who says, oh yeah, I do all kinds of implants over the entire body, I do all kinds of surgeries, and your face too? Should you look at somebody who pretty much focuses?
I don't know that, an individual could do only that one area and do it poorly. So that's not even, that in and of itself is not a requirement. I think you basically have to look at what the individual does, and I feel very comfortable about showing pre- and post-operative pictures, and these pictures are not selected by my best. They're pictures of people who've permitted their picture to be in a photo album or even shown here.
Right.
And if they don't like what they see, that's important for me to know and for them to know, because I don't want them to be unhappy and I don't want to be unhappy. So we have a relationship that we establish before the procedure, and they can see representative work for that individual, and I think that's of course, there's the recommendations from other doctors or other patients. I think that's all very helpful.
And Dr. Eggers, as we mentioned earlier, it's important to see the number of surgeries that this person may
I
have
think
done?
it's not unfair for a patient to say, how many do you do in a week or a month, or how many have you done over the year, to know that the doctor is proficient in that procedure.
And again, specializing on something is a little more, I guess, gives you a little bit more credibility.
A little more credibility, a little more comfortable maybe with that. I mean, let's just leave plastic surgery for a minute. You break your arm, you're not going to go to a back surgeon or vice versa.
Yeah.
You're going to pick guys who fix arms.
Okay.
Some of us have had special training outside, you know, for the routine residency. For example, I've had fellowship training in craniofacial surgery and orthognathic surgery in Toronto and Basel, Switzerland, and that sometimes helps too,
Yeah.
you know, a little bit extended beyond the usual.
Okay. Thank you very much. Coming up, cheeks of another kind. Jennifer Lopez has made it popular to have a fuller rear end. So some people are opting for implants on the backside. And do you have skinny little bird legs? Calf implants can resolve that. But there are some things you should know before seeking out these surgeries.